At these desks, we had our recovery support specialists. So as they make their telephone calls or they arrange to leave, our recovery support specialists again gathering information, trying to determine what their issues are and what would be an appropriate service plan to help them address those issues. And so they will be documenting that information, and that information will be going into our system so we can track these individuals in terms of how frequently they use our services. We are also in conversation with the Homeless Coalition. We're looking at their HMIS system. We anticipate that we're going to be able to use that HMIS system, and that will allow us not only to see, to track how many times the person used our service, but we can also see how many times they use other resources around the community. That becomes very informative as we look at providing information that documents the value of this service to this community. And also, we're going to make a referral to one of the HMIS participants. Then we can also share that information with them. Of course, this is all done with the approval of the client. We have to have the proper releases of confidential information and all of that to share that information. But that is our plan. So now that we've determined that we've got the information, we've given these people a service plan, we also ask them if they will allow us to follow up with them. We would like to actually connect them with a resource in the community, kind of like a case manager, that they will allow to support them ongoingly. Not just when they leave here to see if they made it to where we referred them to, but we want to support them ongoingly. We know that one of the things that's required for successful recovery and for substance abuse is long-term. Is long-term maintenance, long-term absence from the disease. And that often requires long-term support. So we plan to offer a system that account for that kind of support for these individuals and long-term. So now they're ready to go, and we wish them well. Any questions?
Are there resources yet for the long-term case management, or are you relying on your various partners to be able to provide that case management?
We are relying on our long-term partners, but we also developed another program, almost on the same timeline that we developed this program, which is called a Recovery Coach Academy, which is a recovery coach training program. We've trained over probably 150 people or so. That all these people are people that have lived experience, and they want the opportunity to give back. So we run a practicum program out of that academy, and that practicum program requires that people do volunteer recovery support services. So we plan to attach a lot of these people to that resource so they can get the kind of support, that ongoing support. Again, we had to stay as low cost as we possibly could because there are just not very many resources out there to support this. So we're looking at leveraging that, but we're also looking for funding to support the management of that infrastructure because again, I think that will allow us to increase our leveraging of that as a resource. Yes.
Could you remind me again who is upstairs?
Yes.
I didn't quite capture that.
Yeah, that is the City of Houston Police Department mental health unit.
Okay.
And it also has the clinicians, the MHMRA clinicians that are attached to their CERT.
Okay.
So we've got 16 staff up there, and then the mental health unit is up there.
Okay.
Yes.
I'm actually a graduate of that academy.
Yeah, so
and
am I.
it's awesome. It's awesome in my field. And I work with women, so we house over 200 women with substance abuse and alcohol problems. But I wanted to know, are you going to have a recovery coach on 24 hours?
Yes.
And how long would that recovery coach follow that person once they're gone?
And that's to be determined. The recovery coach is really going to be trying to hand them out to another recovery coach in the community. And the reasons for that is that they will only have the ability to track so many people. And because we don't have the volume of people that we have flowing through here, initially it won't be that large a volume. But once we get up to where we got 70 people or so coming through here a night, 4 nights a week, then they're just not going to have the capacity to track people for a long period of time. They just have to unload and get ready for the next group. But we're going to be trying to do a warm handoff as they leave here to another recovery support person in the community.
If clients become agitated and belligerent, how do you handle that? How will you handle that?
We've got staff that's trained in non-crisis intervention, staff that is experienced in psych tech work, but if they become too agitated and non-responsive to our direction, then we'll have them escorted out here by the police.
Do you have any idea what proportions of your clients might speak a language other than English, and how well are you staffed for that?
You know, we don't know, but we've got a significant number of individuals that are bilingual in Spanish and English.
Thank you.
We even have a staff person that speaks Vietnamese.
Thank you.
Yes.
Oh, okay. Doing good? Good, yes.
Will you search the clients? I'm sure the police will, for weapons
Yes.
and remove
Yes,
those.
yes, and we will actually be using a metal detector, because again, it's about safety. It's about their safety and our staff safety, so we will make that clear as they come in the door. It's a part of them being admitted here. That safety is priority, theirs and ours. Thank you. Other questions?
I may have missed earlier when you said about the time that they would be here. Was that about 6 hours or so?
4 to 6 hours on average. We'll have some that leave a little earlier than that, we'll have some that stay longer. But we anticipate that they'll be here. And that's what we've seen in other cities.
After 6 hours.
Well, they don't actually detox, they're just sober. They're just sober. We would need a long period of time for that detox. And we would want to do it, we would want to manage detox a little bit different. We want medical supervision for detox. I know that there is there's a social detox model, but we're not setting ourselves up for that. Okay. We want medical. And we're looking for a detox model as a matter of fact.
Now, if they choose to leave and they're still intoxicated, what do you do in that? Because they are free to leave once they leave them here. But what do you do in that case, especially if they are, well, does someone have to pick them up? Do you have a rule, or they can just go rather than intoxicated?
They can go. We can't detain them. Okay, but we will be using all our professional skills to keep them from leaving. And when we have to, we will threaten them with the law. Again, because it is all about their safety.
What would happen if the facility became to capacity and so people had to wait?
We'd probably have to go on a drive-by. Yeah. And I mean, the city's accustomed to that. I mean, it happens all the time at the hospitals.
Do you mind speaking up a little bit? I'm sorry, it's hard to hear.
Sorry, yes. She asked what would happen if we were at capacity, and I said that we'd probably have to go on drive-by standard. That the police department is accustomed to dealing with that. I think they'd be shocked that we'd be at capacity, but I anticipate that happening, and I anticipate it happening in pretty short order. And that's especially true when we have events like the one we had last weekend, with the NBA, the All-Star game, and other kind of sports events like that. So, but basically what that speaks to is the need for us to expand our capacity. And again, as we think about serving more law enforcement authorities, the Harris County Sheriff Department, as an example, we're going to be looking at that need, the need to expand capacity. Other questions? Okay, then that concludes our tour, so we'll just go back out to the